An experimental pill to treat COVID-19 may cut the risk of hospitalization and death from the virus in half.
Here to answer your questions is Dr. Sandra Nelson, an associate director within the Division of Infectious Diseases at Mass General Hospital. Doctor, thank you so much for joining us this morning.
Thank you.
We know you're still waiting to see data from the drug company Merck, but if the results are accurate here, which patients would benefit the most from this pill?
Yeah, so if the information that's been reported in the press release is confirmed, this is incredibly exciting news and can really be a game changer. Molnupiravir is an antiviral, and antivirals work best when they're administered early in the illness. And the clinical trial looked at patients who were early in the onset of an infection, within 5 days of symptom onset, and were at higher risk for severe disease based on underlying factors like diabetes or obesity. So I think that's the population in which we'll first see it used, but it will continue to be studied in other populations, including those at lower risk and including those who have been exposed to COVID but not yet infected.
Very welcome news. Merck says it does plan to ask the FDA for emergency use authorization. How long could that process take?
So there's no specific timeline for drugs that are being reviewed according to that emergency use authorization pathway, but the timeline really depends on the urgency of the need for the drug. And the FDA is very likely to afford this a very high priority because the drug, if confirmed to be doing what it says it's doing, is going to really fulfill a critical unmet need. So I think that if that process ensues, we could see approval in as early as a few weeks, and certainly we could expect to see the drug on pharmacy shelves before the end of the year.
Okay, we do also want to ask you about the CDC's urgent health advisory this week for women who are pregnant, trying to become pregnant, or just delivered a baby. What are we learning about the risk from COVID for them and their baby?
You know, COVID infection in pregnancy has been another story that has been challenging. We've certainly learned that pregnant women with COVID infection are at higher risk for severe outcomes, including hospitalization, ICU hospitalization, and death. They're also associated with higher adverse pregnancy outcomes, including some suggestion of increased risk of stillbirth, and also prematurity. And the prematurity is really what poses the risk to the newborn. Prematurity is associated with a whole host of complications for infants, and women with COVID are more likely to deliver prematurely.
The CDC says just 31% of pregnant women were vaccinated before or during their pregnancies. Why do you think they're so reluctant to get the shots? And what do you want them to know?
No, I think early on, after the vaccines were authorized for use, there was really no data to support the use in pregnancy, although there was also no reason to suspect it would be harmful. And at that time, there was really a risk-benefit discussion that was recommended between the pregnant patient and the healthcare provider to determine if vaccination was appropriate for that person. But since that time, we've really learned an incredible amount of information that makes this a much greater benefit to pregnant women. Both we've learned about the risks of the infection to the pregnant woman and the neonate. But we've also learned that the vaccine is both highly safe and effective at preventing those adverse outcomes. The CDC is following over 100,000 women who received the vaccination while pregnant, and there haven't been any safety signals so far that would suggest it's not safe. They've looked closely at things like miscarriage risk and pregnancy outcomes and haven't seen any important differences. The other piece is we've learned that it's highly effective against protecting women from hospitalization and these severe outcomes from COVID. And most of the pregnant women who've been hospitalized recently have been unvaccinated. So really, vaccination is critical for this population.
Okay, Dr. Sandra Nelson, Associate Director within the Division of Infectious Diseases at Mass General Hospital. Thank you so much for joining us this morning.
Thank you for having me.